Blake Staker here with Westside-Medical. Today we're going to talk about some of the techniques we use in my clinic here to treat carpal tunnel. Now what carpal tunnel is when you have numbness in these three fingers, when you have compression on the median nerve right through here by the transverse carpal ligament. Now don't mistake it for when you have numbness in all these three fingers, that would indicate you have something with your brachial plexus being compressed here because it's catching all the nerves that innervate the hand. Or if you have numbness in these two fingers here, the ulnar nerve, it would be compressed through here. So what we want to do first is we want to work out the inflammation through here, as well as we want to do some moves to release this ligament so you get that compression off these fingers. So when you have like a nerve that's compressed, it's like if you are driving, you put your hand on like the window console of your car, and these fingers go numb, and that's the tingling you feel. But as soon as you lift your arm off and the pressure's off there, the feeling comes back. That's what this ligament here does. So it's tight, and that constant tension is causing numbness in these three fingers. So the first step, I like to use the voodoo floss here, the Dr. Kelly Starr came up with. So we're just going to kind of wrap this joint. We want to put some compression on it. It's a little tricky to do it by yourself. If you have a partner to wrap it for you, it'd be a little bit easier here. It's about 50%, and this compression is going to squeeze that inflammation, that swelling, back into the lymphatic system so it can be cleared out of that area. Because sometimes that inflammation is what triggers that compression. So you kind of do about an inch overlap here. You're going to have probably a little bit extra left over. Kind of just use that to wrap it. So now you got this here wrapped. Now you want to do some high rep exercise, probably like the 20 to 30 range, and that's going to help contract these muscles, and that contraction is going to push that inflammation out of there. So you take one of these bands, you get a Westside barbell band, you're going to step on it, and you're first just going to work on wrist extension, just like this. That compression and that motion is going to pump out the inflammation. And then you can kind of do some rotations, counterclockwise, clockwise. Once again, you want to do a lot of volume. You want to just keep pumping it. Then you're going to flip it around. You're going to do wrist flexion through here. And then you're going to want to work both ranges of motion. This is good for any kind of wrist injury, actually, to get that inflammation out. The next step, we want to put a nice traction on this joint. So you can hook your band to something. If you want to, let's do this here. So you want to get tension in that band. I might kind of zoom in here so you can see it. So you get tension in that band here, and you're just going to pull it out and just sit here. And this is going to just pull and just traction this transverse carpal ligament out. And you want to do it at least for 2 minutes. You need at least 2 minutes of time to get that tissue change. And so anything over 2 minutes is bonus. You want to just sit there and just hold it and let it open up that wrist joint. Now, the reason for these bands is the band is going to cause a lot more stretch here than just doing it without any kind of a band. It factors it, it's like 10 times the stretch, because it's actually going to fulcrum that joint, and it's going to really just pull it open. So you got to do it with a band. Just hold it for 2 minutes, just really let it stretch that out. Good. So hopefully you guys found that helpful. Visit us at Westside-Medical.com.